So, goodbye 17th Congress of the European Federation of Sexology, and we're looking forward to seeing you on the next Congress, which will be in 2 years. We haven't decided location yet, but wherever the location is, I think the most important thing are the delegates, because the scientific quality of a Congress depends on the contribution of its delegates. So I think with you, that's going to be great wherever it is. And thank you for coming and joining us once again. Considering that the basic goal of psychology is to understand human beings by studying human motivations, human cognitions, and behaviors, and considering the fact that people's faith profoundly affects their motivation, cognition, behavior, there are links between psychology and so, the first question is, why should we study religion psychologically? As you know, religion is the most popular form of all voluntary organizations. And what is the second most popular form of voluntary organizations? Do you know? It's marriage. I mean, although it disappoints 50% or maybe more of all those people who are married, doesn't prevent marriage becoming the second most popular institution in the whole world. Religion leads millions of people and affects their lives. By this sentence, what I mean to say is if we only knew the mechanism that connects millions of people together, we could have used that mechanism to change people, to change in the ultimate goal of having compassion, having love, because while romantic love turns your head, but mature love turns the whole world. Every day, the mass media report instances of religious conflict throughout the world. It's like mass suicides, homicides, inhuman actions. And few human concerns are taken more seriously than religion. As you all know, religion is used to emphasize the significance of messages. When you give a message, just sometimes use the religion and says, religion also says this and that. Marriages are solemnized by religious authorities who interpret the roles of husband and wife in religious terms in some of the society. Birth is sanctified by religious ceremonies. So is death. Daily or weekly rituals, religious, guide the faithful throughout life and influence public for political manipulation, unfortunately. So religion, just like love, is everywhere. And religious ceremonies are always with us, from birth to death. Religion has been a cornerstone of human culture, influencing moral values, behavioral, and societal norms. Central to many religious traditions are the concepts of punishment and reward, which serve as mechanisms to encourage moral behavior and discourage wrongdoing. But does it work like that? I leave the interpretation to you. Religious concepts of punishment and award, like in Christianity and Islam, incorporate the notions of heaven and hell that serve as ultimate rewards and punishments for one's actions. What is the psychological impact? Research indicates that fear of divine punishment can lead to heightened anxiety and guilt, particularly in individuals with strict religious upbringing. There are many studies, but one major study found that individuals who perceive God as punitive tend to exhibit higher levels of depression and anxiety. Studies show that individuals who focus on the loving and rewarding aspects of their faith often experience higher levels of life satisfaction and well-being. And individuals who view God as forgiving report higher levels of happiness, lower levels of stress. Religious teachings often use punishment and reward to modify behavior. In Hinduism and Buddhism, one's actions in this life actually determines their fate in future lives. Belief in karma can lead to increased prosocial behavior and ethical conduct. In Catholicism, the sacrament of confession provides a way for seeking forgiveness and absolution, which may reduce feelings of guilt and promote psychological healing. So, religion and mental disorders have a long and troubled relationship, through which they became intimate enemies. So there are sayings like, God will punish you with madness for disobeying his commandments. Sentences like that. They are still not in total peace and harmony. There is a debate, different opinions about religious people, are they more healthy or vice versa? Or religious people are more resilient, some say, others say they are more rigid. Some of the religious beliefs that were once thought to be irrational are now found to be potentially healthy. We are not living in a fair or just world, do we? In a just world, we tend to believe, or they try to make us believe, that things will always come out to be fair, and therefore sufferers will finally be rewarded. Maybe this is in my turn, as I represent cognitive teachings, is a kind of cognitive distortion, because we all know that this may not be correct. But I always believe that some cognitive distortions are very functional. And if you believe in that, if you believe that things will finally end up in a good way, as long as your intentions are fine, I think even if it's a kind of distortion, we should ignore this kind of distortion. This further cooperation between religion and behavioral sciences may be essential for human betterment. Research evidence suggests that there are more beneficial associations than adverse effects between religion and mental well-being. Amongst 30 studies, 14 showed a favorable relationship between religion and mental health, 9 showed no association at all, and 7 indicated a non-favorable relationship between religion and mental health. So what are the possible relationships between religion and mental states? Religion may be an expression of a mental disorder, like some people believe. We have a ward in my city where we have a couple of gods, a couple of prophets, and so on, It can be an expression of mental disorder. Faith can help people to cope with negative life events, even in the case of extraordinary disasters such as natural disasters, such as earthquakes. We recently had a major earthquake which ended up more than 60,000 people's death, and we faced that kind of problems in the past as well. So even when trauma happens, they believe that there's something coming from God. Maybe they might be more resilient. Religion can serve as a protective agent for some undesired behaviors, such as suicides. Religion can help personal growth through forgiveness and trust. Forgiveness is an antidote to destructive guilt and is related to reduced anger, fear, shame, and sadness. So religion can enhance optimism, helping to cope human suffering that we cannot avoid, and religious beliefs may be one of the best predictors of abstinence from drug and alcohol addiction, abuse, and non-participation in extramarital sexual activities, if you believe in fidelity. Helps people deal with depression and grief, like different ways of mourning, and it might help to get over these grieving time by societal norms, mournings that are done together. So as you know, the cognitive model always tells us that it's not the events that causes the emotions, but it's the interpretation of the events that causes the. So that is the reason why a same event elicits different kind of emotions in different people. And religion definitely affects information processing, because at point P, you have this information processing, and this information processing changes from one person to the other, depending on the past life stories and past experiences they had. Religion can either work to the advantage or disadvantage of a person. Depends on a God to be feared or a God to be loved. A God for punishment or a God for forgiveness. Each person operates in his own particular world. So that's the reason why we believe in unique case conceptualizations. As extremism blunts perception and freezes the flexibility of cognition, role of religion may be paradoxical. It makes prejudices or it unmakes prejudices. There's only one religion to me, and that is to do good, although there may be 100 versions of it. Just going to a church or to a mosque does not make anyone a real Christian or a Muslim, any more than going into a garage makes them a mechanic. So I think it's important that your intentions is very important. Despite the differences, there are also similarities. They all have rituals that followers perform, mostly monotheistic. The pursuit of truth and the inclusion of humans and God interaction, while differences lie in their sources and the nature of truth. So religion may arouse guilt and hatred, like having religious obsessions regarding making sins, and then compulsions to compensate for that, therefore lowering the self-esteem, and may reduce guilt and hatred by acceptance or compassion. When you accept, of course, that doesn't mean that you understand, you give the right to that person, or you obey the rules, understanding, seeing the things as they are, instead of seeing the way you like to see them. So in that sense, I think acceptance in our lives is very important. Remember many years ago, some of you will remember, most of our books was titled as coping with depression, coping with anxiety, and then they softened the word, and they changed it to management, because sometimes you don't have to cope, all you have to do is to manage. So instead of perfectionism, maybe it's good to have good enough solutions. And nowadays, we have the concepts of acceptance. So see where we are moving. Because as time goes by, as you add years to your life, and add life to your years, you realize that you cannot change it. You cannot cope with it. You have to embrace what's happening and try to find the meaning in human suffering and pain. Faith is like water. Extremists everywhere, every religion, war is killing in God's name, extremist Muslims on tragic attacks, extremist Christians giving hate speeches against Islam, and movies made by producers insulting Prophet or Jesus and its consequences. So I sometimes say to myself, dear God, save us from those people who believe in this way. This is not a belief. This is not the best way of believing in something. Although some religious authorities and groups may sometimes be rigid as bricks, faith is always like water. And water always finds a route to flow despite the obstruction of the bricks. Coming to sex therapy and religion, we all know that sex therapists do not practice in a standard world. Therefore, they are expected to be flexible enough to adapt their interventions to the needs of diversity, to the needs of different cultures and religions. As I said in the prior session, we have to learn to grow in diversity because we are diverse. And of course, most of the time, differences are seen as something against equality. I see that we shouldn't be afraid of being different. I see it like if you go to a restaurant, you are given the same menu, and that's called equality, and choosing different food to eat is the differences. And most of the time, the peach being pink does not hurt the banana, but unfortunately in real life, differences sometimes frightens. Societies with different religions differ about what sexual behaviors will be accepted, will be rejected, or tolerated, and therefore sexual problems and their management are not free from effects of religion in the culture. It is therefore very important to tailor and modify sex therapy programs to the needs of the people, to their beliefs, to their values, culture and religion, as religious and cultural factors do influence the way sex therapy is offered and welcomed. Religion enforces regulations on sex and sexual behaviors, so it may become an activity, could be detrimental, or that could be helpful to the individual or to the society. While there is an increasing sensitivity to cultural diversity, when it comes to religion, many clinicians do not want to address the subject in mental health settings, particularly with respect to sexual problems. So we are more sensitive to cultural issues, but when it comes to religion, there's kind of resistance or perhaps avoidance. And this avoidance may be largely due to the delicacy of the subject and the negative aspects portrayed and projected every day by the social media. A society's sexual norms and standards of sexual conduct may be linked to religious beliefs or social and environmental contexts, or all of these. Sexual restriction that emphasizes human sexual activities are only practiced for reproduction and are common, although the spectrum opens like a big fan with a wide range of attitudes, and making sex as the highest expression of divine by emphasizing sexual pleasure. Sexual attitudes, coming to that, religious teachings often provide clear guidelines. Many conservative religious traditions advocate for premarital abstinence and monogamy. Individuals with strong religious convictions tend to have higher levels of guilt if they do anything against those norms and things like that. The relationship between religion and diverse people, LGBT and plus, according to research in social sciences, religious rituals or religion plays an important role in how heteronormative societies view LGBT plus people and same-sex couples. This ranges from discrimination and discouragement of self-disclosure and forbidding same-sex sexual activities and or gender reassignment to the criminalization and violence such as death penalty for people engaging in non-heterosexual activities. For LGBT plus people, religious teachings can be a source of significant conflict. Many religious traditions view non-heteronormative orientations as sinful, leading to internalized homophobia and mental health illnesses. A study found that LGBT plus individuals who experience religious rejection are at high risk for depression, for anxiety, and suicidal ideation. And affirmative therapy has shown to reduce these internalized homophobia and improve overall well-being. Of course, there are different studies with different outcomes. So, religion-informed sex therapy, there are some common elements in it. It is about comfortably discussing sex and removing the stigma attached to it. It's unpacking religious guilt around sexuality, aligning sexual desires with religious beliefs, cultivating a shame or guilt-free view of sex, balancing sex and religious identity, and paving the way for a fulfilling and guilt-free sexual life. Theoretically, that's fine. But of course, there are many obstacles to that. Strict religious upbringing may lead to interpret their natural sexual urges as sinful or shameful, and they generally feel sexually disconnected from their bodies. They don't put themselves in a position where they have self-compassion, but put themselves as the last person to be cared for. They don't hear anything about consent, and they have sexual shame for their developing body, being victims of sexual abuse, and also on top of that, a secondary traumatization, which makes them self-blame for sexual abuse. You know, this always happens. Imagine that you are going into a street after midnight with you're female and you're going there with a miniskirt, and then you get raped, and then in the morning, if you can sleep, when you wake up, you start saying, well, maybe because now you have a different kind of scenario, you believe in a just world, in a fair world, but you didn't deserve this. Nobody deserves it. And but you still start thinking, maybe I shouldn't have passed from that place with this dress at that time of the night. Because you cannot change the view, so you have to accommodate the event according to your perception of life. So what you do is to start saying to yourself, maybe I was in the wrong place, but you have the right to be anywhere with any dress at any time. So people start self-blame because it's always easier to accommodate the events according to your beliefs rather than being able to change the beliefs and being flexible. So this is a kind of self-criticism which happens even in natural disasters. People blame each other, even for the earthquake, saying that this earthquake happened because of losing religious attitudes, rituals, and so on, to punish. Oh, what God punishes a baby who is only 6 months and who dies because of these? I wouldn't be able to say natural disasters. In the past, it was very easy for me to, differentiate between natural traumas, man-made traumas. Nowadays, most of the man-made disasters and natural disasters are kind of mixed. Earthquakes happen not because of a natural trauma, but because of not being able to get precautions for that. So and the setting needs help, and immediate help. And I think it is not the earthquake, but it's responses to the earthquake that causes the death of many innocent people. So nowadays I believe in the mixed form. So PTSD should be redefined, not only having natural disasters or man-made, but the mixture of them too. How does religion affect the practice of sex therapy? Religion and religious factors do influence the presentation and health-seeking behavior of individuals. In the presentation of individuals or couples who are coming forward to seek help, like in Islamic religion, they do not encourage discussion of sexual issues outside the marriage, which makes it difficult for patients to seek help because you're sharing it with others. Most of the time, sex is only discussed in relation to marriage, and therefore religious women who are single are not likely to present for seeking help. All sexual relations outside heterosexual marriage are considered to be illicit and are punishable according to Islamic laws. This makes premarital sex infidelity, homosexual activities, and sex with women working in sex industry illicit as well. Therefore, people, and especially women, who face sexual difficulties in this context are not likely to come forward to seek help. Of course, the religious beliefs also kind of predicts the motivation for a demand for help. Because religious beliefs actually determine whether sexually dysfunctional people will seek out a therapist or not. And when religious people attempt to seek help, it indicates that there is strong motivation attached to it. For individuals coming from strong religious influences, some aspects of sexuality may be unfamiliar or may be a taboo. It may require patience, respect, and understanding to motivate these people. Thus, therapist sensitivity to patients' religious beliefs enhances the likelihood of a successful outcome. Of course, it also predicts the choice for helping agencies. Many religious people come to the clinics not as their first source for help, but often after having tried religious healers. At this stage, therapists' non-judgmental and flexible attitudes may become an important factor in establishing a good therapeutic relationship and maintenance of motivation. So instead of blaming, talk with them. Try to validate what they have done. It's not their fault. So being flexible to these attitudes may have or may end up with better therapeutic relationship and keep their motivation high to seek help. Of course, religious factors also predict the attribution of the cause of sexual dysfunction. In many instances, the cause of the problem is attributed to supernatural factors such as genie, black magic, and defined as struck by evil spirit. Thus, help sought from healers who can purify them from evil spirits or magic. I think it's very important, as you know, if you're following a straightforward approach for treatment of sexual disorder, it goes with homeworks. Homeworks are not given to clients, but homeworks are set with the clients. So you try to make them their own therapists rather than giving them homeworks, telling them instructions, because most of the time there's a myth, a misunderstanding that these approaches tell people what to do, tell them how to think wiser, tell them how to be, more reasonable, rational, and so on. But obviously, the work that we are doing is not a therapy given to the clients, but a therapy shared with the clients, aiming them to be their own therapists in the long run. So compliance with the homework instructions is affected by religious beliefs. But believe me, there's no difficulties. Many Islamic women, although very conservative outside home, are quite open to sexual activities and satisfaction with husbands at home. Where resistance is strong, a step-by-step approach addressing religious concerns provides a greater chance of success. And of course, the trusted therapist makes them very compliant with the homework instructions, which is set up with those people who are coming forward to seek help. And compliance, I would say adherence. I don't like the word compliance, because in compliance you tell them what to do. In adherence, or you do it together. So I prefer to use the word adherence instead of compliance. And whatever the word you use, as Shakespeare says, a rose is a rose. You understand what I mean. So compliance with homework may be difficult during women's menses, as sexual activity is avoided during men's period. Another exception to compliance is due to reactions sometimes given to masturbation exercises. Because if a patient or if a couple comes in together as you probably know, the prognosis is always better because you're giving them something to work on together. But if a single person comes, then there are a few sources that you can get help of. And one of them is masturbation, as they do not have a partner. So, but when they have negative reactions against masturbation, with the reason of being prohibited in Islamic teaching, unless there's exclusive reasons, that makes it difficult to work with the client. Another very important thing is we know that a conjoint kind of therapy, we discussed about this yesterday a lot with those people who came to my workshop, and there's a tendency for many people to come forward by themselves instead of coming with their partners. A considerable number of male presenters are unwilling to bring their spouse into the therapy, and in some couples, the wife actually is unwilling to come and discuss private matters due to the taboo nature of this subject. So, when a person comes in, you try to motivate the male partner that mutual understanding, mutual problem solving is always better than doing it single, and see the problem emerging not from one of the partners, but emerging from the interaction of the partners. You do everything possible to motivate, then they might turn to you and say, yeah, I understand that, but whatever the exercises are, tell it to me, and then I'll pass it to my partner. So it is like, you know, the game from ear to ear. You say something, then at the end of the time, something that comes up, nothing relevant with the things that you have said. So it becomes a remote control kind of therapy. And the clinician has no direct way of knowing whether the program is implemented in the right direction or not. So, let me wrap up, because I need to leave. And I think we are short with time anyway. Sexuality and religion are interrelated and both have impact on each other. Professionals working in the field of sex therapy must develop a set of personal values that is both respectful and non-judgmental. Therapists have responsibility for assessing and working within the client's religious and cultural norms, and tailored programs that are sensitive to couples' cultural and religious norms are more likely to be successful than standard package type of treatments. If you remember the times of Masters and Johnson, when they reported remarkable results from their work initially, and they wrote a book called Human Sexual Inadequacy, and then 10 years later, I think it was Zuckerberg, who wrote a paper, which is very important. Remember, the name of their book was called Human Sexual Inadequacy, and these people wrote a paper called Inadequacy of Masters and Johnson, because they use methods that are not acceptable today. And those times, they talked about their failures and assuming that the rest is success, but they didn't have the success criteria, and also on those times, sexual desire disorders, which is difficult to work with, were not actually defined. It was defined by Kaplan later on. So it is interesting, and of course, the way therapy was offered and welcomed was totally different. So I think it's very important to make case formulations or couple formulations that are unique to that person or the couple, and therefore, instead of, as these remarkable results of Masters and Johnson attracted many professions from very different disciplines to come forward to work in sex therapy. Sex issues always bring money. They had little or almost no experience in terms of individual therapy, couple therapy, so it helped us in many different ways, because multi-professional kind of attitudes is always something that we look for, but unfortunately, if they only stick into a package type of of treatment and give standard treatments instead of making case formulations. At the end of the day, that becomes a disadvantage for the promotion of sexual therapy and so on. So tailored treatment programs that are sensitive to couples' cultural and religious norms are more likely to be successful than standard types of treatments. And there's no doubt that religion dimension presents sex therapists with a challenge. It should be seen as a welcome and healthy challenge, and certainly a rewarding one. And special attention should be paid to religious issues in the training of therapists. And most importantly, I believe, one of the main predictors of treatment success is the therapist's sensitivity and vulnerability and respect to the religious beliefs. This kind of attitude might help overcome resistance in sexual behavior and also definitely keep them engaged in the therapy and reduce the number of dropouts during the treatment. So, just by reminding once again, let's grow in diversity. Let's be respectful to our clients' values, to our clients' religious thoughts, and treat them in a way, or manage the problem with them in such a way, thinking that you are the person who is sitting in that seat. How would you like yourself to be treated if you are sitting in their place? So keep that a relationship. Keep in mind that human-to-human relationship is at least as important as therapist-patient or client relationships. Thanks for coming and joining me today. Thank you.